She had done everything right. She was 67 when her case was first reviewed. She had been seen by 3 physicians in the 2 years before that appointment. Her thyroid had been tested twice, both times in normal range. Her ferritin was low normal, so she had been given iron supplements. She had a prescription for melatonin because her sleep was not restoring her. She had been told her fatigue was likely related to age, possibly mild depression, possibly the stress of retiring and adjusting to a slower pace. She was told to exercise more. She did. She came in still exhausted. When someone sat with her and went through the whole picture, not just each symptom in isolation, but all of them together, in sequence, over time, something did not add up. The iron was not climbing the way it should have with supplementation. The sleep had not improved despite the melatonin and the improved routine. She had developed what she called an embarrassing pattern, bloating that would disappear for a week, then return for 3 days, then disappear again. And she mentioned, almost as an aside, something she had never told the other doctors because she did not think it was related. A recurring itch, mostly at night. She had assumed it was dry skin. One question had not yet been asked. When had anyone last looked at what was happening inside her gut? Not with a colonoscopy, not with a culture for common bacteria, but with a proper parasitological evaluation. Nobody had. 3 weeks later, after a comprehensive stool analysis, there was an answer. This is not a story about one patient being unlucky or unusual. It is a story about a gap in how we think about tiredness, about digestion, about skin, and about all the small signals the body sends over months and years before anyone looks in the right place. That gap is what this video is about. Welcome to Human Health Zone, the channel dedicated to giving you the real health information that too often gets left out of conversation, especially for adults over 60. If this is your first time here, please hit that like button right now and subscribe before we go any further. Not as a formality, but because this kind of content is part of a longer, connected series, and the videos build on each other in ways that genuinely matter for your health. And before we go further, we want to be completely honest with you about something important. Human Health Zone is a fan channel created purely and only to give credit to Dr. Eric Berg DC, one of the most trusted and respected voices in evidence-based health education for adults in the second half of life. Everything shared on this channel draws on his research, his clinical perspective, and his commitment to helping people understand what their bodies are actually telling them. Now, here's the question we want you to hold until the very end of this video. Of all the natural foods and compounds we're going to discuss today for gut support, one of them stands apart from the others because its activity appears to target something that almost every other natural and pharmaceutical intervention misses entirely. We will tell you exactly which one and exactly why before this video ends. Let us stay with the question that case raises. Intestinal parasites are not, as most Americans have come to think, a problem that belongs to other countries, other climates, other living conditions. The World Health Organization estimates that more than 1.5 billion people carry soil-transmitted helminths at any given time. That number does not account for protozoal infections, organisms like Giardia lamblia and Endemoeba histolytica, which are detected in water systems and food supplies across North America and Europe every year, including in places with modern sanitation infrastructure. Giardia alone is the most commonly diagnosed intestinal parasite in the United States. This is not shared to alarm you. It is shared because the assumption that this is not possible for you, that your lifestyle or your zip code rules it out, may be one reason why the right question never gets asked. There are 5 signals to hold in your mind right now. Not because all 5 appearing together means you have a parasitic infection, but because each of them, particularly when they cluster, when they cycle, or when they persist despite treatment of other causes, deserves a closer look. The first is fatigue that does not respond to sleep. This is a specific kind of tiredness. It is not the fatigue that improves after a good night's rest. It is the kind that is present in the morning as reliably as it was the night before. Patients describe it as heaviness, like something is consuming energy before they have a chance to use it. After 60, it gets dismissed easily. Age is a convenient explanation. But when fatigue does not shift over weeks, when it shows up alongside other gut symptoms, when it coexists with lab results that are just slightly low on iron or B12 without a clear explanation, the question of what is happening in the gut deserves to be asked before aging is accepted as a final answer. The second signal is digestive irregularity that cycles. Constipation for a few days, then loose stools, then a week of what feels like normal, then back again. People get used to this pattern. They adjust their diet, try probiotics, drink more water. Some of this helps temporarily, but the cycling continues. This is a pattern associated in certain patients with organisms that have their own biological rhythms, reproduction cycles, and feeding cycles, that the gut responds to in waves. It is not proof of anything on its own, but it is a pattern worth noting. The third is intense craving for sugar and refined carbohydrates. This one surprises people. Most expect the craving to be blamed on stress or habit or blood sugar instability. All of those are real causes. But certain parasites rely heavily on glucose for energy and are capable of interfering with the gut-brain, signaling that regulates appetite. To be clear, craving sugar does not mean you have parasites. What it does mean is that when a person over 60 reports a sudden increase in carbohydrate cravings alongside fatigue and digestive cycling with no change in their overall diet or stress levels, that combination deserves investigation. The fourth signal is skin changes without an obvious cause. Eczema-like patches, hive that come and go, adult acne appearing for the first time or returning after years, unusual itching on the limbs or trunk. These can all have dermatological explanations, but the gut and the skin communicate through a network of immune signaling that is far more active than most people realize. When the gut's mucosal barrier is compromised, which is one of the things certain parasites cause, immune activation can manifest on the skin in ways that seem entirely unrelated to digestion. And the fifth signal is the one that most patients are too embarrassed to mention, nocturnal perianal itching, the itch that comes at night around the rectal area, which most people chalk up to hemorrhoids, dry skin, or diet. This is a cardinal symptom of pinworm infection, a remarkably common parasitic infection, particularly among adults who live with children or grandchildren who attend school. Female pinworms migrate to the perianal skin at night to deposit eggs. The itch is the body's response to that migration. It is specific, and it is almost never mentioned in a medical appointment unless a physician asks directly. These 5 signals, taken alone, mean little. Together, with the right history, they become a clinical argument for a different kind of evaluation. Here is what concerns many physicians who work in this area about how this gets managed in standard clinical practice. When a physician orders a stool test for a patient with digestive complaints, what they usually order is a stool culture. A stool culture looks for bacteria, Salmonella, E. coli, Shigella, Campylobacter. It does not look for parasites. It does not look for parasitic eggs, cysts, trophozoites, or larvae. To detect intestinal parasites, you need a different test, a stool ova and parasite examination. And even that test has limitations, because parasites do not shed eggs continuously. They do so in cycles. A single stool sample on a single day may come back negative even in an active infection. Most guidelines for suspected parasitic infection recommend testing at least 2 to 3 samples collected on separate days. Giardia and Cryptosporidium have antigen-specific tests that are more sensitive, and they should be ordered specifically if those organisms are suspected. They are not part of a standard stool culture. They have to be requested. This is the gap. A physician sees a patient with fatigue and digestive complaints. They order blood work. They order a stool culture. The results come back without a red flag, and the conversation moves on to other explanations. The right test was never ordered, not out of negligence, but because the thought did not occur to anyone, because parasitic infection in the mind of most clinicians belongs to a different kind of patient. What Dr. Eric Berg DC has emphasized in his clinical work is that this assumption costs people months, sometimes years, of unnecessary suffering. Patients who had been on antidepressants for fatigue-related mood changes, who had tried 3 different iron supplements without their levels improving, who had been told their digestive symptoms were IBS when the actual explanation was sitting in their gut undetected because no one asked for the right test. Now, pay close attention here, because this next part is the one that changes how you understand everything else we have already covered. The gut is not a collection of separate problems. It is a territory. And if something is living in that territory without belonging there, you cannot solve the downstream problems by treating them one at a time. Imagine the lining of the small intestine laid flat. It is roughly the size of a tennis court. It is covered in tiny projections called villi, and those villi are responsible for absorbing every nutrient the body needs. Iron, B12, zinc, magnesium, fat-soluble vitamins. They are also the first line of defense between what you eat and your bloodstream. Consider what happens when an organism settles in and begins to compete for that space. Helminths, which include roundworms, hookworms, tapeworms, and pinworms, attach to the intestinal wall. Some, like hookworms, feed directly on blood. Others consume partially digested nutrients before the villi have the chance to absorb them. A moderate hookworm burden can cause daily blood loss significant enough to produce iron deficiency anemia that does not respond well to oral supplementation. Not because the dose is wrong, but because the underlying cause is not lack of iron coming in. It is loss of iron from within. Tapeworms are particularly efficient at depleting vitamin B12. A patient can have borderline low B12, receive supplementation, see modest improvement, and still never reach stable levels because what is absorbing B12 first is not them. Protozoa like Giardia work differently. They do not burrow into the wall. They coat it. A heavy Giardia infestation creates a physical barrier over the absorptive surface of the small intestine, effectively insulating the villi from the nutrients passing by. The result is malabsorption that can be broad. Fat-soluble vitamins, carbohydrates. Giardia infection also disrupts the gut's tight junction proteins, the microscopic seals between intestinal cells that keep the contents of the gut inside the gut. When those seals weaken, the immune system inside the gut wall activates, generating low-grade inflammation that does not declare itself obviously, but contributes over time to fatigue, cognitive fog, and immune dysregulation. This is the cycle that most people miss. Parasites deplete nutrients. Nutritional depletion weakens the immune response. A weaker immune response allows parasites to persist longer and in greater numbers. More parasites generate more inflammation. More inflammation damages the gut lining further. A damaged gut lining absorbs less. Less absorption produces more deficiency. The body keeps sending signals. They show up as fatigue, as skin changes, as mood shifts, as the inability to feel rested despite adequate sleep. But because each signal is treated separately, the fatigue gets a supplement, the skin gets a cream, the mood gets a medication, and the loop continues. There are 4 things that change in the gut environment after 60, and each one shifts the balance in favor of an organism that does not belong there. The first is gastric acid. Stomach acid is a remarkably effective barrier. When the stomach is working at full capacity, the highly acidic environment kills many pathogens before they can reach the small intestine. With age, the stomach's ability to produce acid often declines, a process called hypochlorhydria. This is compounded significantly by the widespread use of proton pump inhibitors and H2 blockers in adults over 60, medications that reduce stomach acid intentionally for reflux and gastric protection. What they also reduce as a consequence is one of the gut's primary defenses against ingested organisms. This is noted purely because understanding the mechanism matters, not as a reason to stop any medication without a physician's guidance. The second is gut motility. The rhythmic contractions that move contents through digestive tracts slow with age. Food, and anything that came with it, spends more time in the gut. That extended transit time gives organisms more opportunity to establish themselves. Slower motility also contributes to the cycling pattern described earlier, the alternating constipation, and loose stools that many older adults experience and accept as normal. The third is immunosenescence, the natural aging of the immune system. The result is that immune surveillance inside the gut, the constant monitoring that identifies and eliminates foreign organisms, becomes less responsive. Parasitic infections that a younger immune system might have cleared without producing symptoms can gain a foothold more easily after 60. And the fourth is the microbiome itself. A diverse, robust gut bacterial community creates a competitive environment. Beneficial bacteria occupy space and produce compounds that make the gut inhospitable to many pathogens. Research from the National Institute on Aging has shown that gut microbial diversity tends to decline with age. A less diverse microbiome is less resistant, and a gut environment already disrupted by antibiotic use dietary change, or chronic stress is even more vulnerable to the kind of ecological disruption that parasitic organisms cause. Before we continue, here is something important. Everything covered in this video is for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. If you recognize any of the symptoms described today, please bring them specifically to your physician's attention. Only a licensed healthcare provider can evaluate your individual situation, order the appropriate tests, and recommend the right course of treatment. None of this means that everyone over 60 has a parasitic infection, but it does mean that if the body sends these signals, particularly after a period of travel, after consuming water from an uncertain source, or after a gastrointestinal illness that never quite resolved, the threshold for investigation should be lower, not higher. Here is what to do with all of this practically. First, if you recognize several of the signals described, chronic fatigue that does not improve with sleep, digestive cycling, unexplained nutritional deficiencies that do not respond to supplementation, nocturnal itching, or skin changes without a dermatological explanation, please bring this specifically to your physician's attention. Do not wait for it to be raised. Ask by name for a comprehensive stool ova and parasite examination collected on 2 or 3 separate days. If Giardia is suspected, ask for a Giardia antigen test specifically because a standard ONP exam misses it in a meaningful percentage of cases. Some clinicians will be familiar with this request. Others will need the direct ask. You are not being difficult when you ask for a specific test. You are giving your physician relevant clinical information, a cluster of symptoms that warrants a particular kind of investigation, and you are asking for the tool that addresses it. That is not overstepping. That is participating in your own care. Second, confirmed parasitic infection, especially with helminths, often requires pharmaceutical treatment. There are effective, well-tolerated antiparasitic medications, albendazole, mebendazole, and metronidazole for protozoa. These work. The natural approaches we are about to discuss are supportive and preventive, and there is real evidence behind them. But to be direct with you, if you have a confirmed infection, please treat it with your physician. Do not substitute herbs for a diagnosis that needs prescription. And third, if testing comes back negative but symptoms persist, that does not end the conversation. A single negative result does not rule out infection. It narrows the probability. Keep the inquiry open. Now, the part of this video that connects daily food choices to the biological reality we have been describing. And here is where we reveal what we asked you to hold at the very beginning. Of all the natural compounds with documented gut-supportive and antiparasitic properties, one of them stands apart. Not because it kills adult parasites more effectively than the others, but because its activity appears to be directed specifically against something the others cannot reach. We will come to that in a moment. First, the full picture. Garlic contains a compound called allicin, which forms when raw garlic is crushed or chopped. Multiple laboratory studies have shown that allicin has activity against a range of intestinal parasites, including Giardia, lamblia, and certain entamoeba species. For this to be clinically relevant, the garlic needs to be raw, and it needs to be consumed fairly soon after preparation. Allicin degrades over time, and cooked garlic produces far less of it, a half clove to a full clove of raw garlic. Chopped and allowed to rest for a few minutes before being added to food, is a practical way to incorporate this consistently. This is not a treatment for active infection. It is a reasonable addition to a gut-supported diet. Pumpkin seeds have a long history of traditional use against intestinal worms across many cultures, and there is now research to explain why. The active compound is cucurbitacin, which appears to cause a temporary paralysis of certain helminths, impairing their ability to maintain their grip on the intestinal wall. Studies in animal models and some small human trials have shown measurable effects. The amounts used in traditional preparations are not small, a significant handful of raw, unsalted seeds, not a sprinkle over salad. The consistency of use also appears to matter. One day of seeds does not do what a few weeks of incorporation can. Ginger does several things at once that are relevant here. It has documented antimicrobial and anti-inflammatory properties. It improves gut motility, which matters for mechanical expulsion, and it supports the mucosal lining of the gut in a way that appears to counter some of the barrier damage that parasitic infection causes. It is also one of the most tolerable daily additions, whether in tea and cooking or as a supplement with a well-established safety profile, even in older adults. And now, the one we asked you to hold from the very beginning, the one that stands apart, clove. Clove is a compound that genuinely surprises researchers in the space because its activity appears to be directed specifically against the eggs and early-stage larvae of certain parasites. Most antiparasitic interventions, both conventional and natural, work against adult organisms. Clove, through its primary bioactive constituent eugenol, is one of the very few natural compounds with demonstrated activity against the earlier reproductive forms, the part of the parasite life cycle that most treatments do not reach. If that mechanism holds across further research, and it is important to be transparent that much of this work is still in early stages, then clove's role is less about eliminating the adult organism and more about disrupting the next cycle, preventing reinfestation from within. That is a fundamentally different and potentially more important point of intervention. What I understand about these four is that they do not work like antibiotics. They are not precise, potent, or reliable enough to serve as treatment for confirmed infection. What they can do, used consistently over time as part of a diet that also includes high dietary fiber and adequate hydration, is make the gut environment less hospitable, support the immune function within the gut lining, and contribute to a daily biochemical environment that is harder for organisms to exploit. Fiber deserves a separate mention. Soluble fiber from sources like oats, flaxseed, and cooked legumes acts as scaffolding for everything the gut does. It slows digestion appropriately, feeds beneficial bacteria, and binds certain waste products for elimination. When the gut is working to clear an unwanted organism, or recovering from having hosted one, fiber is the unglamorous, reliable support structure that makes the rest possible. Most adults over 60 consume far less fiber than their gut needs. Here is clear guidance on when the signals described cross into something that needs medical attention promptly, not eventually. If you have unintentional weight loss alongside the fatigue and digestive symptoms, see a physician soon. If you have visible blood in your stool, or stools that are consistently pale, greasy, or foul-smelling in a new way, that also warrants prompt evaluation. If the fatigue is severe enough to interfere with daily function, if you feel genuinely unable to carry out activities you could manage a year ago, that is not a signal to manage at home. If you have recently traveled, particularly to areas with less reliable water treatment, or if you have had a gastrointestinal illness in the past several months that seemed to resolve but left you with persistent symptoms, fatigue, bloating, irregular stools, that combination is a clear indication for testing. And if you are immunocompromised for any reason, including medications that suppress the immune system, the threshold for testing should be lower and the conversation with your physician should happen sooner. Here is what to come back to after everything covered today. The body does not send ambiguous signals. It sends specific ones. Fatigue that does not respond to sleep is a specific signal. Digestive symptoms that cycle on their own schedule are a specific signal. Nutritional levels that do not improve with supplementation are a specific signal. The problem is not that the body is unclear. The problem is that we have a habit of sorting those signals into separate drawers. Fatigue goes to the energy drawer. Digestion goes to the gastroenterology drawer. Skin goes to the dermatology drawer. And nobody stands back to ask what might connect them. What connects them in cases like the one we open with is sometimes simply something that was never looked for. She recovered. Her iron normalized. Her sleep changed. The cycling stopped. Not overnight. Because these things take time and they require proper treatment followed by real rehabilitation of the gut environment. But she got better. And she said at a follow-up appointment that for 2 years she had been told the problem was her age. She was 67. She had 30 years ahead of her. That is the part that stays with you. If this video helped you, smash that like button. Subscribe to Human Health Zone for more evidence-based health content built specifically for adults over 60, and turn on notifications so you never miss a video that could matter for your health or for someone you love. Share this with a friend, a family member, a spouse, because the person who needs this information most may not know to search for it. And we want to hear from you. Which of the 5 signals we described today surprised you most? Have you ever had symptoms like these and struggled to get an answer? Tell us your story in the comments. We read every single one, and your experience may be the thing that helps someone else finally ask the right question. And one last thing, Leave us a comment letting us know which city or country you are watching from. We have viewers across the USA, the UK, and from all around the world, and we love hearing from every one of you. Take care of yourself, and we will see you in the next video.